Hello, welcome to Body Tips. Today we are going to learn about numerous reasons why joint pain occurs. If you're not yet subscribed, then subscribe now. Joints are complex structures in our bodies that connect our bones, allowing us to move and perform various activities. However, joint pain is a common ailment that affects people of all ages and can significantly impact their quality of life. While there are numerous reasons why joint pain occurs, here are some of the most common factors: age and degeneration. As we grow older, our joints undergo natural wear and tear. The protective cartilage that cushions the bones may start to deteriorate, leading to conditions like osteoarthritis. This degenerative process can result in joint pain and stiffness. Inflammation and autoimmune disorders. Inflammatory conditions like rheumatoid arthritis, gout, and lupus can cause joint pain. These conditions occur when the body's immune system mistakenly attacks its own tissues, including the joints, leading to inflammation, swelling, and discomfort. Overuse and repetitive motion. Engaging in repetitive activities or placing excessive strain on a particular joint can lead to pain. People who participate in sports or have physically demanding jobs may be more prone to joint pain due to overuse injuries such as tendinitis or bursitis. Injuries and trauma. Accidents, falls, or direct blows to the joints can cause acute joint pain. Ligament sprains, muscle strains, fractures, or dislocations can all result in significant discomfort and limited mobility. Weight and lifestyle factors. Excess body weight puts additional stress on the joints, particularly in the weight-bearing joints like the knees and hips. Maintaining a healthy weight and leading an active lifestyle can help alleviate joint pain and reduce the risk of developing certain conditions. Genetics. Some individuals may have a genetic predisposition to certain joint conditions, making them more susceptible to experiencing joint pain. For example, conditions like rheumatoid arthritis can have a genetic component. Other health conditions. Joint pain can also be a symptom of various other health issues such as infections, septic arthritis, metabolic disorders, gout, hormonal imbalances, hypothyroidism, or even cancer. While joint pain can be bothersome, there are ways to manage and alleviate the discomfort. Treatment options may include medication, physical therapy, lifestyle modifications, heat or cold therapy, joint injections, or, in severe cases, surgical intervention. It's important to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan tailored to your specific condition. With proper care and management, joint pain can be minimized, allowing individuals to lead active and fulfilling lives. Thank you.